What is a resection margin in Whipple pancreatic surgery? Imagine removing a tumor from the pancreas and wanting to make sure no cancer cells are left behind. That's where the concept of a resection margin comes into play. During a Whipple procedure, also known as pancreaticoduodenectomy, the surgeon removes the head of the pancreas along with parts of the bile duct, duodenum, and sometimes nearby tissues or vessels. The edges of this removed tissue are called the resection margins. These margins are like the borders of a cutout, and their status tells us if the cancer has been completely taken out or if some might still be left inside. The importance of the resection margin is huge because it helps determine the patient's prognosis. After surgery, a pathologist examines the tissue under a microscope to see if cancer cells are present at or very close to the cut edges. If cancer cells are found at the margin, it's called an R1 resection. This suggests that some tumor tissue might still be in the body, which can increase the chance of the cancer coming back. On the other hand, if no cancer cells are seen at the edges, it's called an R0 resection, meaning the tumor was completely removed with clear margins. During the operation, surgeons often mark these margins with special inks to help the pathologist identify and examine each boundary precisely. The main margins checked include the pancreatic transection margin, where the pancreas is cut, the bile duct margin, the retroperitoneal or uncinate margin, which is near major blood vessels, and sometimes the vascular groove margin if blood vessels are involved. These margins are carefully analyzed because their status influences further treatment options, such as additional chemotherapy or radiation therapy, especially if cancer cells are close to or at the margins. Achieving clear margins is a key goal because it is associated with better long-term survival. When margins are positive or close, doctors may recommend more aggressive treatments to target any remaining cancer cells. The assessment of resection margins also helps in planning follow-up care and in evaluating the success of the surgery. It's important to remember that each patient's situation is unique, and the extent of cancer spread can vary widely. That's why ongoing consultation with healthcare professionals is essential for personalized treatment planning. In summary, the resection margin in Whipple pancreatic surgery is the edge of the tissue removed during the operation. Its status, whether free of cancer cells or not, plays a crucial role in determining how complete the tumor removal was and guides the next steps in treatment. Always consult with your medical team for personalized advice and to understand what your specific margin status means for your health.